Thank you, Dr. Rutherford. I appreciate it. I want to just first say thank you to all of our panelists who took time out of their schedules to be with us tonight. They all are busy. They all are experts in the field of epidemiology. Right now, you are real busy and working on various things. And to take time out of your schedule to spend with us to help the people who view our service, our broadcast. Is certainly the concerns, particularly in our community. Dr. Judy Gilliard, she's a PhD as well as an RN, a nurse researcher at Florida International University College and health science located in Miami. Dr. Gilliard is in research participation of underrepresented. Thank you so much for being a part of this panel tonight, Dr. Gilliard. Dr. Russ Jones is a board certified family medicine physician at the University of North Florida College of Medicine. He's in the Department of Community Health and Family Medicine in Jacksonville. Dr. Jones approaches healthcare provision from a social determinants of health model, recognizing the impact of education, housing, food security, and community safety on health outcomes. Dr. Jones, welcome. Thank you so much for being part of the panel. Dr. Fern Webb was unable to be here tonight because of a health issue in her office, but we want to thank her for the prep of being ready tonight. And she also represented with an alternative, and we're grateful for that as well. I wanted to acknowledge her. Dr. C. Perry Brown, is a professor of epidemiology at Florida A&M University. Dr. Brown, thank you so much for being a part of the panel tonight. I wanted to open up, not with our questions, but just from the standpoint of, from each one of you, where we are, what we need to do from a vaccine standpoint. And basically, are the vaccines safe? How do we get out of this seemingly long night? So if we can open up just with your opening words with that, I would appreciate it. Let's start first with Dr. Gilliard.
Good evening, and thank you for inviting me. I think that we are in for a long haul, only because I don't think all of the population understands the importance of the vaccination. I know there's a lot of misconceptions about what the vaccine can do and cannot do, but I would advise people that are still skeptical to talk to a trusted healthcare provider and get very clear information about their personal risk, because now we're seeing the younger population get COVID that initially we didn't anticipate that would happen. So this is a new space for everyone. I think in the United States, we've never had a pandemic before. So from a public health perspective, we've never had to sacrifice ourselves for others. That's a new concept for a lot of people, except those that are faith-based. I'll put it like that. I heard a pastor say this morning on national news that he took the vaccine not for himself, but for his brother. In other words, I took it for my congregation. And I thought that was a nice way to put it. I'm preaching to you about God, but I'm getting the vaccine so that I won't expose you to whatever risk I have that I don't even know about. So I think that's a great way to put it. I took the vaccine for my brother, for others. And I think when we explain it that way, for a lot of people, it might be a little bit easier to handle. And because we're not used to doing things for others, for a lot of people, that's a hard concept to swallow. Thank you.
Dr. Brown.
Yes, I think that what's important to keep in mind is that At this point in the pandemic, where we are in Florida is a point where we are riding a wave, the fourth wave. We initially had a wave in January, February, early March of 2000. And then we thought it's summer, it probably is going to go down. And then because of some other things, it didn't. And then it waned a little bit. Then it went back up. And now we're seeing daily cases. I was just looking at some data. Yesterday, there were 21,000 new cases diagnosed in the state. Yesterday, there were 357 people who did not recover from COVID. And if we think back about 3 weeks ago, or maybe 4 weeks ago, 5 weeks ago, we had single-digit deaths in the state. And now we're at 357 and rising. So as we think about this COVID, I think we should, my perspective, of course, is from the epidemiologic, but there are some other things. I think Dr. Gilliard mentioned something very important. Those of us who are vaccinated, those of you who are vaccinated, become the ambassadors for vaccination. It's real easy for a negative experience to gain traction in a friend community. Someone says, oh, it made me sick, it knocked me out, I lost work, and that travels real fast. Unfortunately, sometimes it travels faster than the good news stories of individuals who have been vaccinated. Okay, their arm was sore, they had a fever, but it's better than having a tube down their throat because now they're in intensive care.
Yes.
So become the ambassadors.
Thank you. Dr. Jones.
Sure. So at this point, I would say that everyone just needs to get vaccinated. So I know that people are still hesitant about it, but we really can't wait. Like Dr. Brown was saying, people are dying. I don't know, in Jacksonville here, we've actually had several national news stories about how overwhelmed we are. I can say for myself how many patients I've had who've had to sign death certificates or come in and let me know that a family member has been deceased because of COVID. And I think we don't have that time to wait. So whatever information you need to find out to feel more comfortable about it, really take that time. And like Dr. Gilliard was saying, talk to that trusted source, talk to your primary care provider. If you have one, CDC has a really great website that explains all about the vaccine. But I also want people to understand that COVID, when they say even a mild case of COVID, can have really devastating long-term consequences. Mm-hmm. I have had many patients who come in who are pretty functional adults, working construction, teachers. Now they're on dependent on oxygen. And if you can imagine that toll of the amount of functioning in that activity level, how that decreases and what that changes for their daily lives, I think that's such important. That's why it's a reason to get vaccinated. Also thinking about the long post-COVID syndrome, which we're just learning about. You know, there's people who are having chronic pain. They're having what they call brain fog. So they're not feeling like they're not thinking as sharp as they used to be. There's heart problems, there's neurological problems or nerve-related problems. So I think when we look at the balance of getting COVID versus getting a vaccine, I would take having some soreness, having a fever and headache for a couple of days versus what the potential long-term consequences of having even a mild case of COVID.
Thank you. That was powerful. Also joining us tonight, Dr. Shavondra Huggins. She's a faculty member of the Department of University of Florida. Welcome to the panel tonight. Thank you for taking time out of your schedule. What I'd ask if you as well will just give an opening statements about your input, insight on what we should do as a people, as a community, in terms of this virus and the vaccination.
Good evening. Thank you. Thank you so much. All the other speakers ahead have pretty much summed up the things that I usually speak on about that. Number one, you must get educated. Educated by, like Dr. Gilliard said, someone who's trusted, but most importantly, someone who is knowledgeable. We love to listen to our friends and, that favorite relative that we do trust with our life and our cooking, so to speak. But when they're not medically and or scientifically educated behind how the vaccine was developed, what is its purpose, making sure that they truly understand that there has never been anything out there that said the vaccine was 100% going to prevent it. However, they need to understand it does decrease the symptoms as well and decrease your ability not only to contract, but to transmit. And again, I'm sorry, Dr. Gilliard hit a lot of true points. Sometimes you have to not do them for yourself personally, you have to do them for others. I am a single mother of 3, and in my household, one is unable to get the vaccine due to age purposes. And I, again, work for the College of Nursing. I teach in undergraduate and graduate programs, and I'm in and out of the hospitals all the time. I see what Dr. Jones and Dr. Brown have talked about. I see the ICUs, MICUs, SICUs, I see the intubations, and if I know that I have contributed to that due to my lack of vaccinations, knowing that I am at a greater risk of being exposed due to what I do, that was just something that, did not sit well for me. So I was among that first wave that got the vaccine, and that was something that I was glad to do. And if not for anything, for the sake of my children, making sure that I kept them safe and the community safe. And so people need to make sure that make an educated decision about why you will or will not get a vaccine. In this case, it is very important to do so. You must do so. Like Dr. Jones ended it with, it's not just pre-getting COVID, it is what if you get it? And then you might say, oh, well, I got it and now I'm good, or I know someone else who got it and they were good, but you don't know what's gonna happen long-term and how that could affect your household financially, because you may not now be able to do that same laborious job you did before, or now you have to just depend on the oxygen, in which, unfortunately, I hate to say it's not free. So how does that now budget into your household income and those things? So all of that is our reasons. It's not just that one, and it's not just you. It's about the community as a whole. Very important.
Very good. Thank you. Well, the talk, most of what I hear is, well, I don't trust the vaccine because they came up with it too fast. In just a few months, they had a vaccine. Whereas previously, other medicines, it take them years before it comes to the market. So why should I trust this vaccine? What would you say to that person? Dr. Brown, your mic is on mute.
Thank you. I would say this. The COVID virus is a member of a family of viruses. The first that we knew of this family of viruses in an outbreak was something called SARS. And that occurred in 2002. And as a result, there was like 8,000 individuals infected across 2 continents with 3,000 deaths. We started working on a vaccine in 2002. So to say this developed too fast, actually, we had an 18-year development cycle. And then the next virus in that family was something called MERS. We were still working on a vaccine for the family of viruses. So it didn't take much. Well, it took a lot of money that the federal government went to the researchers and said, here we have this novel virus. What will it take? They gave them a blank check. What does it take to move slightly to look at this virus and develop a vaccine? And the 3 companies that came out, well, actually there's 4 that came out with a vaccine that seemed to be effective and it seemed to be safe. So no, this didn't roll out in 6 months. This rolled out over 18 years.
I would add to that, Remember the Ebola crisis, which was similar to SARS? Well, it was a SARS virus. It was in an isolated place. It was in Sierra Leone, West Africa. Some of my colleagues went to Sierra Leone and helped to administer care to the individuals that contracted that virus. But because it was in a isolated place in a continent of Africa, it didn't spread as vast as the current virus. I think from that incident, as well as the ones that Dr. Brown has spoken of, we've already had the platform of how the virus operates. What's unique about this, and I'll ask the doctors to add, was that this was the first time it became a global pandemic. In such a fast rate, it spread from all places of the globe. But when you think about it, I can be from here to New York in 2 hours. I can be to China in 5. I can be to Dallas in an hour. So because travel is so vast and we're such an international global society, it gives us reason to believe that yes, it could contract that fast, especially since it's in the air, it's viral. So I will just reiterate everything that was said prior, but it wasn't just developed. It's been around for 18 years. And our government, the National Institute of Health, had the platform to actually expedite the development of the vaccine, only because they were working on it before in case something like this happens.
Wow. Wow. Thank you. That's well said. And I tell you, what we wanted to do in this forum, in this panel discussion, because, of course, of the years and of the issue with, the Tuskegee Institute issue, we don't trust certain people when it comes to science and data. And so we wanted to make sure we had some people that we thought we could trust to get us the information. I wish now that we had done this panel a year ago so that our people would be better informed with people that they believe they can trust and to understand the major differences. I'm going to get into some questions that were raised. One of the first questions I have is from Stephanie. Stephanie says, hello, could you please explain the importance of being vaccinated versus being unvaccinated? Social media is circulating this info, but please remind everyone about the importance of being vaccinated, that more unvaccinated people are in the hospital and dying. What's the difference between vaccinated people who are dying and unvaccinated people? And can both spread the virus, and both can contract the virus, and both can be hospitalized from the virus? Dr. Huggins.
Yes, I just like to touch the surface. A lot of questions in that one. So the way you kind of want to look at it is, do I want to take the risk of being unvaccinated and getting COVID? And the odds right now with especially the surges are greater than none, unless you're just like in a bubble. Or do I want to get vaccinated ahead of time? And as people like to say, and take the risk of getting side effects of the vaccine. And all vaccines have side effects. So number one, let's make that very clear. But getting the vaccine, what the research has shown in data, you get a vaccine, and there's only 3 out on the market, and I'm not sure if that was touched on briefly. There's 4 actually, like Dr. Brown said, but there's 3 that are approved in the U.S. right now for emergency use. So you hear about the Johnson & Johnson, the 1 shot, you hear about the Pfizer, and you hear about the Moderna. And the Pfizer and Moderna are the 2 shots. The Pfizer is the one that children under the age, children 12 and older can get. So that's how you kind of differentiate those 3. All of them pretty much give you the same side effects. Most of the time, the side effects may tend to be a little worse after the second vaccination, but it's going to be things like the sore arm, okay? Like fever, it can give you a headache, it can give you fatigue, so you're sleeping a lot, those types of things. Would you prefer to just get that be done with it over like 3 to 5 days. And if you were to get, so that's the number one, vaccinated versus unvaccinated. At least you know for the most part what you're getting into when you're vaccinated. When you're unvaccinated and then you end up getting COVID, it can be something from the same symptoms that the vaccine will give you, in addition to you can't taste, you can't smell, bad coughing, shortness of breath. Hospitalization is more likely to happen in the unvaccinated. Do you get admitted? Do you get intubated? It is more likely to happen with the unvaccinated. The purpose of being vaccinated is that, can you still get COVID? Yes. And I just have to throw the caveat out there that I hear people say all the time, well, why should I get the vaccine? I mean, it's not going to protect me from COVID. I can still get COVID. They didn't tell us that at the beginning. It's always been told that the vaccine was not 100%. However, each different vaccine gives you a higher percentage rate than, of course, an unvaccinated person of not only preventing getting it. If you are exposed, it would take you a longer exposure time to get it. And then also, if you did get it, you shed less of the virus, so you're less likely to spread it compared to people who are unvaccinated. And if you do, again, it's one of those things, you need to be around someone longer, unmasked, so forth and so on. So yes, you're vaccinated, can you get it? You can. If you're unvaccinated, can you get it? You can. Which risk do you want? The possibility of being vaccinated, being able to be home, isolate and yourself, maybe some milder symptoms, and now you don't have a hospital bill, you aren't intubated and so forth and so on, or be unvaccinated and then take that stronger risk. Again, neither one of them are you protected from it, because you're not. Things that we don't know about the vaccine are more of things like, if you get COVID, yes, you may have a antibody system or against it where you may not get it again. But you will at some point. We don't know how long you just getting that COVID on your own, if you are, you recover from it well, how long are you protected versus the vaccine? I'll be honest, we don't know that either, but you have a better protection, a better coverage, least likely to spread it. And that's why it's so important that we're continuing to push this vaccine. Again, why should I get the vaccine? It's not going to protect me 100%. I can still get COVID again. All of those are things that people say and why they don't get it. But the spread would be less. It will be slower. It gives time for other people to get vaccinated. And this pandemic doesn't continue to grow. And these different waves don't continue to happen. And that's the difference in why the vaccine, for me, is very much so a number one choice than to be unvaccinated. I'd love some of the other panel colleagues to chime in.
I think Dr. Jones was about to answer.
Sure. So one of the things, like Dr. Huggins was mentioning, is by getting the vaccine, we also think about deaths, right? That's what I think about. I want my patients to be alive. When you're vaccinated, the chance of you dying is much less likely. Right now, in these waves of deaths that Dr. Brown was talking about at the start of the talk, most of these when you're looking at various state averages, it's over between 90 to 95% of those people are people who are unvaccinated. So that's the vast majority. And then when we do see breakthrough cases, those are people who are already immunocompromised. So they're either taking drugs that suppress their immune system, like those who have lupus or rheumatoid arthritis, or they have some sort of cancer. So those are people who are already high risk. So we're putting these people at even more risk. Additionally, if we really want to go back to normal, how it was pre-pandemic, and everybody wants to go back outside, we really have to get the vaccine, because the more time that the vaccine has out in nature, in the natural state without people being vaccinated, the more time it has to mutate. When it mutates, that's when these different variants arise. And as we can see, as the variants arise, we don't know what each variant will bring. This new Delta variant, as we see, is twice as contagious as the Alpha variant that we were first dealing with this time last year. So we're seeing that there's a potential for it to be even more deadly than it is as time goes on. So that's why I really push that we really need to make sure that people understand the need to get vaccinated.
Thank you. Akila has a question, very good question. Good evening. For tonight's conversation, I would like to know if the vaccine will affect the woman's fertility long term?
I was actually doing some literature search on this very question. There was a study out of Israel. Women who were vaccinated were no less likely, or I should say, were no more likely to have adverse birth outcomes. And vaccinated women in another study were not found to have any difference in their fertility. So the birth rates, the conception rates of women were the same. Now, let me speak to men. I just read a study in which, looking at men's fertility in terms of sperm counts, in a trial or in a study, the sperm counts in men who were vaccinated actually increased about a month after their second vaccination. So there are obvious concerns. There are always concerns with something like a vaccine or a medication. But in this case, the data to date has not borne out any ill effects in women's fertility or in birth outcomes as measured by infant birth weight or coming to term, preterm births. None of that has panned out.
And additionally, when you look at the literature, early studies, when we looked at people who actually got COVID, not the vaccine, the COVID virus themselves, they actually saw that there was a decrease in men's sperm counts and sperm quality. And those are two important components to actually conceiving a child. And that showed that so those who actually got COVID, not the vaccinated, that's when we got the virus itself, their sperm count and quality actually decreased. So that's really important to note. Also, the American College of Obstetricians and Gynecologists, the largest group for medical professionals who deliver babies, they recommend that all pregnant women get the vaccine.
And just to add on to Dr. Ross, that is my love and actually one of my first master's degrees. I'm board certified as a women's health nurse practitioner and have years of experience in working in an OBGYN office. And so, yes, women that are even in preconception stage, meaning that they're not currently pregnant, but they are working to become pregnant, it is still recommended that they get the vaccine. If you are pregnant, it is still recommended that you get the vaccine. There really is no deadline or cutoff. If you are pregnant of which trimester, you should or should not get it. The University, UF Health actually did do a presentation maybe 2-3 months ago that actually said they're not 100% sure, but they do think that getting the vaccine sometime in the third trimester may actually be of benefit. And may form some type of antibodies to pass along to the infants as well. But again, you don't have to wait till the third trimester. You could get it preconception. You can get it anytime during your 9-month, or as we would say, 40-week time frame in the pregnancy. Like Dr. Brown said, it has no side effect on, does it make you go into preterm labor? Does it make you miscarry? None of those have been linked to any of the vaccines. And lastly, you can breastfeed as well if you are vaccinated, or if you just delivered and now you want to get the vaccine and you're breastfeeding and that might be a barrier for you, it is safe to breastfeed with that as well.
Actually, one of the studies that I read found that in breastfeeding moms, they transmitted neutralizing antibodies to their child, which are somewhat protected. So having been vaccinated, and then while the child obviously cannot be vaccinated, there is some level of protection that can be conferred to the child through the breastfeeding process.
Oh, wow. It's powerful. I have been fully vaccinated. And Tamika has a question as well that I think would add to this, to my position. I would like to know more about COVID-19 booster shots. Today, we recognize CDC came out and said we're going to recommend, but the FDA still to approve the booster shots. Why is it needed, and how often will we need to continue receiving booster shots? A question from Tamika.
I'll start off. Remember, this is uncharted territory. So we're constantly getting evidence, updating the public on the evidence, and trying to explain to the public benefits and risks. So the data about booster shot comes from Israel, in which they're beginning to find that people that have gotten vaccinated with the Pfizer vaccine in January are beginning to lose some of the viral count. So what they're recommending to people that have impaired immune systems, people that are older, might be on cancer therapy, or have some compromised immune system, that they get a booster, as well as those 65 and over, to help extend the protection, extend the life of the vaccination that they've already gotten. So what does that mean? Does it mean it doesn't work? No, it doesn't mean that. It just means that they're trying to keep a constant level of the antibodies in your bloodstream so that you don't get the virus. So it's a good thing. The other evidence that came out is that you should wait at least 18 months after you've been, not 18, I'm sorry, 8 months after you've been fully vaccinated. So 8 months, excuse me, after you've been fully vaccinated to get the booster. Okay, if you feel you have a higher risk. And the two other doctors can add to that, as well as my colleague nurse.
Sure. So like Dr. Gilliard was saying, there's two types of really immunity when we think about it. There's what we call the neutralizing antibodies that Dr. Brown was talking about. Those are kind of the antibodies that go and attack the actual virus. And then we have another set of immunity called humoral immunity. That's kind of where you had this infection in the past, the body kind of knows what to do, but it hasn't produced those big gun cells that's going to actually kill the virus. So when they're looking at those studies, they're showing those neutralizing antibodies, the antibodies that will actually attack the virus and kill it, kind of decrease as time goes on. So that's why you need a booster shot. So if you think about why we get a flu shot every year, it's similar to that. And then also as viruses change, you'll need they'll have to configure the virus a little bit different so to make sure that you continue to have the same level of protection.
I would like to make sure that this is a very important thing that a lot of people say. Oh, I got my second vaccine yesterday. I'm fully vaccinated. You're not yet. So let's make that term very, very clear. To be fully vaccinated, deemed fully vaccinated, is 14 days after your second shot, if it's the Pfizer and Moderna, because again, those are 2 shots, 2-dose vaccinations, or 14 days after your Johnson & Johnson. So that's number one. However, again, I was going to say what Dr. Jones said. Think of it like the flu vaccine. To take that myth away of what Dr. Gilliard started with. Oh, we need booster shots. This vaccine don't work anyway. So again, why should I get vaccinated? No, it works, and it's working rather well. It's just like the flu vaccine. Think about it. We offer the flu vaccine how often? Every year. Why? Because every season that flu can, what we say, mutate. Okay. And so until we know what has happened in the previous and see what's happened in the previous, now we can come forward the next season and make another vaccine, to help protect you from all the previous ones that's been exposed. And this isn't a new thing for vaccinations. Tetanus, we are to get booster tetanus shots. Okay. And guess what? Some people have to get booster MMRs, measles, mumps, and rubella. Some people have to get tetanus varicella, which is the sister vaccine to, or the mother vaccine, so to speak, to the chicken pox. So these are vaccinations that usually we've gotten in our childhood years. I don't think anyone in the panel has gotten the varicella because we are a little more seasoned. However, if you were to do an antibody screen on any of the vaccinations that we've gotten as a child, you still need to see, do you have enough antibodies there to make you what we call immune? So, and if you do, then you're safe, you're good. But then you still can fall in a window of what we call being equivocal or being non-immune. And if those things happen, then that means you need a booster of some sort. So that goes back to my initial statement of being educationally sound before you make decisions to say whether you will or will not do something. You need to truly understand the whole aspect of it, and not just go off of we need a booster, therefore the vaccine doesn't work. That is the farthest from the truth.
Thank you so much. Let me welcome Dr. Fern Webb, who's joined us tonight. Thank you. I know she had some issues with joining us because of staffing, but you've joined us tonight, and I really appreciate you joining us. Dr. Webb is a social behavioral epidemiologist at the University of Florida College of Medicine, Department of Surgery in Jacksonville. She specializes in conducting research on holistic health interventions with community engagement work focusing on sharing evidence-based information on COVID-19, cancer, and other chronic and infectious diseases. Thank you for joining us, Dr. Webb, tonight. Well, question is, if I do contract COVID-19, what should I do? I heard recently that there is a drug out there that's not offered widespread, but we should seek after monoclonal. Are you familiar with that? And what would you suggest?
And so first of all, if you're talking to me, thank you, Dr. Hughes. It's my honor to join with such esteemed colleagues. And so I will defer to my clinical colleagues on the panel to address that question.
Sure. So if you get COVID, what you should be doing is you should be doing really what we call supportive care at first. So those are kind of treating the symptoms. So getting lots of rest, drinking lots of fluids. You can also try over-the-counter cold medicines, depending on your conditions, to manage your symptoms. Also, you can talk to your primary care provider. We are doing what we call monoclonal antibody treatment. That's when they give you those antibodies we talked about before in the immunity, except it is in a kind of a shot form. So it will give you 4 different shots in your abdomen, and that'll help decrease the severity of your symptoms from COVID. However, you have to meet certain criteria. So usually that criteria is things that will put you in a higher risk category, such as you have certain respiratory conditions, your weight, your history of, if you have any history of cancer and that sort of thing. But your primary care provider can talk you through that. Also, the state of Florida has set up various centers throughout the state where you can receive these treatments as well. But really, your main thing should be focused on the things you always do when you get a cold or a virus. Try to drink a lot of fluids, stay away from people, make sure that you get kind of quarantined in your house if you can, so we can prevent transmission. Wipe down those surfaces with bleach or any kind of other quality cleaning products. And really just, wait your 10 days of quarantine, 10 to 14 days of quarantine, and to prevent transmission. And then let your healthcare provider know, so in case you do start having red flag symptoms, they can alert you to what's the next best step.
Wonderful.
If anyone else wants to chime in, please do. I do want to, again, I'm just big on making sure people don't take what they want to hear from this and not what they really should be hearing from this. That is not a go-to thing, okay? We need to be proactive, not reactive. That is something really that you would want to get once you've gotten the actual vaccine, or if you have been exposed to someone who was positive and maybe you're waiting to see if you test positive. We can't afford to be reactive. That is not going to help decrease the surge and get us to that herd immunity that we need, so we can, like Dr. Jones said, be back outside, safely outside with no mask and within a 6 feet distance of people. That we will not go back to that norm anytime soon if people will not get vaccinated. So yes, that medication is out there. I'm actually very glad that it was brought up on the panel so people can get a little more education about it. But I need to make it clear, at least from my perspective, that is more of something reactive. It's not proactive. It is not to replace the vaccine. And for my people who don't like to get shots because they're scared of needles, listen to what Dr. Jones just said. That's 4 shots, okay, in the abdomen versus your 2 over 21 days or 28 days depending on Pfizer or Moderna, and only one shot with the Johnson & Johnson. So I like to throw every angle at someone because, we can be very creative in our culture. We have all types of excuses or barriers. So I just want to make sure that that point was also brought up for clarity. Let's be proactive, okay, together at the united front and not reactive.
And let me just add to that. You will get that once you got COVID. And the purpose of getting it is so you won't die. It's the same thing. They are both investigational drugs. But when I tell people you get 4 shots, they're like, oh, no. So education is power. Be educated, not reactive. All of the drugs are meant to keep you alive. The earlier you get it, the more likely you will be alive. Once you get COVID, that medication, if I'm not mistaken, should be given within 48 hours. If you wait too long and you start having severe respiratory problems, you no longer become a candidate for that medication. And there's a list of criteria of who will get it. Now, I appreciate the medical community of Florida that made that an option to people that were hesitant against the vaccine, but they don't understand the implications as well as all the background information that has to be obtained by your primary provider or agency that's administering that monoclonal antibody before you can qualify. So while you're trying to get qualified, you might be getting sick, and we might be at another service for you that might not be as happy.
Thank you.
You're welcome.
You know what? I really wish that, and we got people watching on various platforms. We have our Facebook, we have our website, and we have our YouTube, and people are watching on the various platforms right now. But I'll tell you, this needs to be mandatory for everybody in our community to watch, see this information, hear this information. You guys are giving us some wonderful information that is so needed in our community. And I just tell you right now, I'm so grateful for you. Thank you. I have another question. If an individual has had COVID-19 and recovered, but has not been vaccinated, can that person contract COVID-19 again or any variant and pass it along to someone?
Yes, you can. That's why we want you to get vaccinated. When you get a natural infection with COVID, you only are immune to that specific variant. The vaccine has been tailored so that you can have a little bit wider immunity to a different variant so far, but you can still get reinfected. That's why we're talking about the importance of the booster shot. Over time, those antibodies will wane, and so you can get the potential to get reinfected. That's why it's important to get those vaccinations when they're available to you.
And most importantly, again, when you're unvaccinated, you are spreading it at a more rapid rate than a vaccinated person. So you are going to contribute to the problem and not the solution, okay? You getting it on your own is not the alternative to getting the vaccine.
Another question, what additional medications that can be taken to build the immune system besides vitamin C and D and zinc?
Well, they've been looking at the various studies. There's nothing shown to be really kind of a silver bullet for COVID vaccine. You know, a lot of talk was talked about elderberry when it first came out, and there, so you got all these elderberry syrups and gummies and all this variety of different things. But when you actually look at the science behind it, and none of it really holds up. So what I always tell people is try to be the healthiest you can be. So that goes back to the general tenets of what we always talk about in medicine: eat right and exercise, and then manage your stress, right? Because that'll make your immune system the best it can be to fight off any infection. So the recommendation is at least 30 minutes of exercise 5 times a week at least. Make sure you're eating at least 5 to 8 servings of fruits and vegetables. Some of that should be a lot of the leafy green vegetables because those have the nutrients we're talking about before, the magnesium, the zinc, and those sort of things that'll help support those cells of the immune system. And then make sure you're managing your stress. And then good, you know, we saw this good hygiene. So hand washing is super important, staying away from people so you minimize your exposure. All of those will help prevent COVID.
Thank you.
And wearing a mask.
And masks, yes. Another question that came in, should vaccinated and unvaccinated family members spend Thanksgiving together?
It depends on how big the family is and how big the gathering is. If your family is 2 or 3, have a great Thanksgiving. But if you have 100 people, vaccinated and unvaccinated, it's no way to tell. You still should be practicing some kind of precautions.
Yeah.
I'll be honest. The way I would answer that question is, and I'll make it personal, because sometimes when you get personal with people, it hits home a little bit more. Without trying to tear up, I literally just dropped my firstborn, my oldest, off to college yesterday, and so my family had. Thank you, Dr. Brown. Big things here. So my family had her at going away dinner yesterday. However, my family size that were invited and actually who knew, so no one's feelings would get hurt, was very small. It was a grandmother, it was an auntie, it was a cousin, it was her 2 siblings, and it was her other cousin. The cousin had a baby, so that was cousin. And that was it. And actually one of her good friends. But guess what? Everyone that came into my home had to have a negative COVID test. And out of all the people I named, the 2, there's an infant who can't get vaccinated, my son who's under the age of being vaccinated, and it was just one person who has yet to be, 2 people that were yet to be fully vaccinated. Everyone else in my house was fully vaccinated, but I still required, if you wanted to come into my home that I call my happy abode, that I want to be able to comfortably take my mask off, I needed to see a negative result that was a PCR and not an antigen. Make your own rules, you know, I mean, but that was me. And again, I have people that live in my home that cannot be vaccinated, and I feel it's my duty to make sure I keep them as safe as possible in the one place that they want to call their safe haven.
I'm actually loving the people that are being creative and having drive-by parties. My uncle, who is 70, for his birthday, his daughters gave him a party. They made dinners, they put in styrofoam containers. You came by, you blew your horn, you got your take-home dinner. I think that's a great way to celebrate. Here's your uncle, love him while he's alive. And that's the way we have to celebrate now until we have a better way of doing it. And I think that was a great alternative.
Another question, Elvania has a question. How do we move forward, knowing that children under 12 aren't able to be vaccinated and are transmitting COVID to their families?
We move forward by everyone who's over 12 and able to get vaccinated.
Absolutely.
That's how we move forward. That's how we move forward. And being vaccinated, you're still wearing your mask. You're still social distancing, and you're still washing your hands. And I'll be honest, myself and all my kids, we keep hand sanitizer on us, and hands are just as crusty and chapped because of that hand sanitizer. And I tell them, hey, when you can get to soap and water, use your soap and water, and I'll buy you some lotion. I'd rather invest in lotion for you continuously washing your hands than invest in a funeral service. So that's how we move forward. You know, it's hard to, I mean, it's a sticky situation. Let's make it clear. It's a very sticky situation. I have 2 children. Well, I told you I have 3. One's off to college in a dorm now, back on campus. The other 2 are in school. And so, you know, but depending on the age, they can't get vaccinated. You know, keeping them home last year and making it online, you know, that does something to mental health for everyone, and let alone the kids. They need that social interaction as adults do as well. And so, you know, if we want to get things back to a new norm, so to speak, and for our children, we as adults need to step up to that home plate and get vaccinated.
And then, I'm sorry, I just want to take this a little bit different track. But I also think we need to understand the risk that it's having to kids. When you look at admissions to hospitals for children's hospitals, since they've been going back to school over this last couple of weeks, we've seen an 85% increase across the country in admissions for COVID for these kids. So it's not just the adults who are getting sick. The kids are getting sick now, too. In Jacksonville, we just had a 16-year-old die 2 weeks ago from COVID related. complications. So to me, it's really important, impactful. A 16-year-old dying from something that if we had got the shot, could have been prevented. That's the way I think about it. It's not just, people think about these deaths in the abstract, but it's somebody's brother, sister, cousin, mother who's passing away from this, and it's something that we can prevent by getting vaccinated. So if you have the chance, the ability to get the shot, I recommend, and I can't recommend any higher, to go get the shot.
Amen.
Moving forward, and I said this earlier, we have to really think about not only what we can do for ourselves, but for others. I mean, with all the rates going up in children, and if I'm not mistaken, there was a young baby, younger than 16, that died here in Miami from COVID. So we really have to think about the things that we do, not only protect us, but it protects people that we don't know, and it's protecting us from the unseen. You know, the fear of COVID is we can't see it. You know, you don't look a certain way. You don't act a certain way. You don't live in a condo or a wonderful house. You get it. Nobody is immune. So if we look at it in that perspective, is that everyone we come in contact could be a person that's potentially carrying COVID. We have to take precautions for ourselves and wear the mask to prevent ourselves and the others that we come in contact from getting it. And then the hand sanitizing all the time. I have my thing, and I have it, and I walk around my classroom. I teach, right on the board, I hand sanitize. Teach, right on the board, hand sanitizers. And I tell my students, you know, stay away. You know, if it's really important and I'm not paying attention to you, yell my name out. That's the only way to get my attention.
I want to tell you about our congregation. We were shut down for a little over a year, and then we opened back up. We opened back up on Easter, and we were open for 4 months. Rather. And when the information came out about the Delta variant, how aggressive it was, and how it has, you know, a lot of people were bypassing and not being registered as having it because it was not going into the nostrils, it was going straight to the lungs. That made me shut down again. Could you speak to us about the Delta variant, educate us on that, and possibly what we're hearing now about the Lambda variant?
I think that, once again, the Delta variant would have occurred anyway, because that's what viruses do. We mutate. You know, to say viruses mutate implies that they do it on their own, but they really don't, because we have the mechanisms that replicate the viruses. So we're responsible for new variants. And the unvaccinated who get infected are responsible for possibly new variants. And yes, Pastor Hughes, there is a Lambda variant. It was first identified in Peru. And it's not that somebody from Peru came to the US and sneezed on someone. It's that people who became infected mutated the virus. And so my prognostication is that we're going to see Lambda here. We're going to see the next generation here unless we're vaccinated. Unless we vaccinate. So yeah, it's something to be concerned about. The Delta variant, as has been mentioned here, is much more infectious than the Alpha variant, which was the garden variety first generation of COVID-19. There'll be a Lambda, there'll probably be an Iota, and we give them Greek names, and hopefully we won't run out of Greek alphabet. I think Dr.
How does the Delta variant work? Because what I've read is, and it goes straight to your lungs and it doesn't give them any symptoms before you realize you have it. And then when you do realize you have it, it's almost too late. Is that true?
Well, I think I would say it's partially true, right? So these COVID vaccine has the variable expressions of the symptoms in each person, right? Because it's really dependent on what we call the ACE2 receptors. So it's each person kind of has a different set of receptors. And so how that virus fits in that receptor, you can kind of think of it like a lock and a key. And so if you're just that unlucky person who has the kind of ACE2 receptors that are really receptive to COVID, then you'll present those symptoms on your, and usually the ACE2 receptors are on your lungs, they're in your brain and various blood vessels as well, but primarily in the body, they're on your lungs. So if they just hit that key, you have that master key that can hit all those different receptors, it's going to show up in the lung a lot faster. Also, what they're saying is that the Delta variant is kind of has a higher, is producing a higher viral load. So you have more virus attacking those cells compared to the Alpha variant. And so that's why you might be seeing a difference in symptoms as well. So it's not necessarily it's training that's different. It's just you have a lot more and it's a better fit.
Well, listen, I want to say to all of you, you have been phenomenal. And we're going to make sure we show this over and over again. We're going to keep it available and refer to our community to continue on wherever you are, whether you are in Florida or not. We want people to continue to see this panel tonight, get your information. We thank you so very much. I am sure tonight, as a result of you taking time, you saved lives. I'm sure of it. I'm sure of it. I'm sure you saved sicknesses, you saved families, economic plight as a result of not getting sick because they're going to go and take the vaccine. I really appreciate it. Piney Grove, the church I pastor, we really appreciate it. All those watching, we appreciate it. State of Florida, we wanted to get the best epidemiologists we could in the state of Florida that could come and speak to us, and you did just that. And from the bottom of our hearts, we really appreciate you. We're in your debt. Whatever we can do, and a part of this path of making humanity better, don't hesitate to call upon First Baptist Church, Piney Grove. Any last words you want to say before you go? Anyone?
Yeah, I think one of the things that I really want to make hit home is, for me, this is a health equity issue, meaning the people who we see dying from this are Black and brown people. And so I really want to make sure that when people are hesitant of getting the vaccine, that they understand that. And when people talk about Tuskegee, and this is one of my bugaboos, is when people talk about Tuskegee, they always get it wrong. They always think that Tuskegee is that the government was giving syphilis to people. No, what happened was we withheld treatment. What would happen now is we're preventing the treatments out there is available for us to get, and we're not taking it. And so we're doing this damage, and there's a whole bunch of reasons why I'm not mistaken, like a historical, I mean, there's tons of stuff we do wrong in healthcare. I understand that completely about why they don't completely trust us. But this is, in this circumstance, this is opportunity for us to get the treatment. They're not withholding it. They're actively doing things to, when the first time they're actually going out into communities and they're actually investing in Black and brown communities trying to get these treatments and vaccines. And so it's really up to us to really take that education and do whatever needs to move you towards getting that vaccine, whatever other questions you have at this point, really make an effort to go get those answers from a trusted source and a knowledgeable source so that we can prevent these deaths.
Thank you. Thank you. Last words, Dr. Gilliard?
Just going to say, reiterate what was said. Please get vaccinated for yourself, for your own health, and for the health of others. You can live longer. If you get COVID now, the hospitals are full, and you might not get the best care. So that's the other thing to be mindful of.
Dr. Brown, last word.
Those of us who have been vaccinated, continue to be the beacon of valid scientific information to friends and relatives, and continue to be the ambassador and the cheerleader for vaccination.
Dr. Huggins, last words.
Again, be proactive and not reactive. If you don't take anything away from this discussion, just hit a few highlights, just a few bullet points in your mind about the vaccines, how many are available, the fact that you will be less transmissible, the fact that you probably will not be hospitalized getting it. You know, give them those key facts that they need. And Dr. Jones definitely hit something that I wasn't even going to go there with the Tuskegee thing, but very true thing. That's been another barrier. They gave people syphilis. No, they didn't give it. And at this point, we're trying to prevent everyone from getting something. And again, we're giving you something for free. And we are not taking it because we don't know what's in it. Be honest, you don't know what's in the food you just get from a drive-thru. You don't know if it was dropped. You don't know if, excuse me, I'm sorry, if a nail was broke off in it. You don't know if they washed their hands. I mean, we don't know what's in what we're eating. There's a lot of unknowns. There's a lot of unknowns. But what we do know, and the data shows it, is that people who are vaccinated are spreading it less. They're less likely to get it. Yes, they may still get it, but they're still spreading it less. They're less hospitalized, and there are less deaths. So I'm going to always go with the facts and not the foes.
Thank you. Thank you all very much. Dr. Webb, is she still with us?
She was having technical issues. She had to drop off.
Okay, all right. Listen, again, thank you all so very much for your time, your effort. May the Lord bless you. Let me close in prayer tonight, if you will. Father in heaven, we're so grateful and thankful for this information. You said in your word that your people suffer because of a lack of knowledge. God, I pray that you will now use this information, that it will be for the betterment of humanity and for the glory of your name. Thank you for these doctors, these specialists, these epidemiologists who've taken time out of their schedule to make sure sound, good information is given out. I pray your blessings upon them, and I pray the blessings on those who will hear this panel discussion tonight and use it for their benefit, for their lives. It is in your favor for life. It is in your favor to have abundant life, and health is a part of that. We thank you for the sense and the ability to obtain information like science so we can use it and give you glory. It is by you that we have the intelligence that we have. We thank you now. In Jesus' name we pray. Amen. God bless you all. Thank you so much. Have a good night.
Thank you. Good night.